Jesus, all the way. I'll forever trust in you. Jesus, all the way. JC24/7.
You must have heard or read of the story of Little Red Riding Hood when she was on her way to her grandma's house and discovered that the wolf was pretending to be her grandmother. She saw his teeth and asked the question, "Grandma, what big teeth you have?" To which he responded, "Better to eat you with." Well, that may apply to wolves and other such animals of the wild. But how does it apply to human beings? Does the consumption of food have anything to do with the size of our teeth? Would our lifestyle be altered by our teeth at all? You guessed it. This morning we are talking to the whole question of dental health. And we have invited in studio Doctors Vaughn Sweet and Delphina Ovid. Thank you for taking the time to be with us on JC24/7. And let's get right into eating the particular subject matter for today. Dr. Dentist, how often should we visit your office?
Ideally, patients should visit the office twice a year, every 6 months. And the purpose of that visit would be for examination and for, well, routine examination, x-rays if necessary, and for cleaning of the teeth. If that visit is not done, then any diseases that may have propped up in between would not be detected.
Right.
Gum disease could proceed unabated, cavities could proceed unabated, oral cancer, which is very easy to, or easier to treat if it is detected earlier, would proceed unabated. And when it is finally discovered because of pain, swelling, abscess, anything, then the treatment becomes a bit more complex. So if patients visit every 6 months for that that routine prophylactic visit or preventive visit, then that helps prevent the developmental disease. In addition to that, gum disease is associated with systemic diseases, with diseases of the body. For example, increased gum disease, the presence of gum disease increases the risk of heart attack and stroke with the presence of atherosclerosis.
Okay, so essentially visiting the doctor has a lot to do with prevention. And so we shouldn't wait until we have pain.
We should not wait until we just have pain. No.
Okay.
Yeah. Added to that, I think we should view your dental team as for prevention, restoration, and rehabilitation. So don't wait until you're in pain to come to see the dentist. Okay.
Are there certain types of foods that we should consume to enhance the dental health of our teeth?
Foods. Okay, in terms of cavities and so, you have to consider, if you consider the anatomy of your teeth, you notice that there are pits and fissures, or grooves, and then you notice your teeth are in close contact with each other, and then some of them are to the back that are difficult to reach. So foods that are sticky, that can stick in the grooves, and may be difficult to remove. I mean, you have your saliva that serves like a lavage that washes your mouth and so, but foods that can stick in your teeth, even if you partake of them, we would recommend that you brush your teeth so that the curious process would not be.
I have had this experience of using certain types of fruits, after which when I went to brush my teeth, there was a sensitive response to the toothbrush. What causes that?
Sensitivity is normally because of recession of the gums, which is covering the surface of the root of your teeth. The enamel is harder and is not porous. However, the roots of the teeth would generally be a thin layer of cementum under which is dentin, and the dentin is very porous. So once that is exposed, the teeth tend to be a lot more sensitive. The other reason that there could be sensitivity would be because of early or progressing decay in the tooth. So that if you do have sensitivity, the ideal thing would be to visit the dentist. If there is sensitivity, one of the ways to reduce sensitivity would be to use some kind of toothpaste that blocks up the porous surface of your tooth,
right,
or that reduces the nerve conduction in the exposed nerves in the porous surface, in the porous dentin. But when you go to the dentist will decide whether or not that is an acceptable final treatment, or whether a filling needs to be done, or surgery needs to be done to reposition the gum to cover the exposed
Let's get to something.
dentin.
Thank you so much. Let's get to something very uncomfortable. Bad breath. What causes bad breath? Is it the food we eat? Is it has to do with oral hygiene? Or is it that some people are born with this malady?
There are various reasons that people can have halitosis or bad breath. Sometimes the foods we eat, like garlic and onions, which are very pungent, but most times it's because of poor oral hygiene, and it can also be due to certain diseases like diabetes. The ketone bodies in the bread could give you that bad odor. But as dentists, of course, we would recommend that you brush and floss properly so that the food debris that's present in your mouth, the bacteria don't have time to feed on that to produce acids and other toxins that can produce that bad smell.
Speaking of brushing and flossing, how often should we brush our teeth? Some people brush it as soon as they get up in the morning. Some make it their duty to brush it the last thing at night. How often should one brush his or her teeth?
Ideally, you should brush after every meal for hygiene purposes. But the normal recommendation is to brush twice a day. And ideally, the second time you brush should be at the last thing at night, after you have eaten all that you're going to eat, so that you're not going to put further food in your mouth that will stay and ferment over the course of the night while you're sleeping. So the second time should be last thing at night at the end of the day.
It doesn't matter what toothbrush I may use. I may want to use a hard toothbrush, or something that could make sure the food comes out.
We won't recommend hard toothbrushes.
You wouldn't recommend hard toothbrushes?
No. Some people are so...
So we have to throw away my hard toothbrushes.
Yeah, I would recommend that. Sometimes, we are so vigorous in what we do, you can actually brush away the enamel on your teeth as well as your gum line, and that causes sensitivity. Some people brush so hard that they brush all the way into the pulp and actually kill their teeth.
Wow.
So we would recommend a soft toothbrush. Okay.
For male and female?
Yes, it doesn't depend on the sex.
Are there specific types of toothbrushes that we could use, or doesn't matter?
There are different types of toothbrushes, but the main design feature that would normally improve the brushing, the effectiveness would be brushes that have the bristles at different levels.
Oh, okay.
And that allows the bristles to get in between the teeth more effectively. Because if you look at it right now, you can see that the bristles cannot get in between the teeth.
Definitely, right.
So what can help is to alter the technique of brushing.
Okay.
So and we normally recommend, therefore, that the toothbrush is held at an angle, and you brush. And when you do that, you will find that the bristles get between the teeth more effectively. Now, tied to your question about what kind of toothbrush is how long you brush your teeth, because some people brush for too long, some people brush for too short.
I tell you.
If you brush for 10-15 seconds, you're definitely not getting the toothbrush around all of your teeth.
Right.
But if you brush for 15 minutes,
15 minutes is it?
You're probably not. I have some patients who have told me that they brush for 15 minutes, and I'm trying to get them down to 2 minutes.
2 minutes.
From 15?
From 15 minutes.
That's interesting.
What I would normally tell my patients is that if you divide them out into 12 different sections, the outside of the back teeth on one side, the outside of the front teeth on the same jaw, outside of the back teeth, 1, 2, 3, and then the inside again.
Right.
You do the same thing, 1, 2, 3, on the top and inside again.
Right.
1, 2, 3, three different segments.
Right.
12 segments in all, outside and inside. 10 seconds each segment.
Right.
That's 2 minutes.
Okay.
Right, 120 seconds. The other thing is that has left out the biting surfaces of the teeth, which will be brushed separately.
Right.
Which should be brushed. Once you brush those areas, you should not take more than 3 minutes.
Right.
For most patients. Patients who have gum disease might need to have their technique altered to brush more effectively, but generally it's the amount of time that is the most important factor in toothbrushing.
Let's get into the matter of chewing before we swallow. How important is chewing? And because I observe that our teeth is much different from that of a wolf, for instance, or any of the animals of the wild. I suspect it has to do with the diet, or the particular diet that the particular animal has to consume. We have these smaller teeth. How important it is for us to chew our food before we swallow?
Chewing or mastication involves breaking down your food into small pieces, and this increases the surface area. And in the mouth, in the saliva contains an enzyme called salivary amylase, which begins the digestive process. So as you crush your food, more of the food is exposed to the enzyme, and the salivary process, the digestive process begins, and later on, lots of better absorption.
When I was younger, I was told that we were supposed to masticate for 32 times. How practical is that? I mean, come on. Doc, tell us.
That is not necessarily accurate. The ideal thing is to chew the food effectively until it is converted into a type of paste that you can easily swallow. If it is still hard pieces, let's say you chew off a hunk of meat, then and you just swallow, then it would not be broken down enough to allow the digestion. On the other hand, something like rice would be broken up very quickly with 1 or 2 chews. So that you don't need to chew that for as long as you need to chew something like meat. So it's really based on the texture of the food that you get adequate breaking down.
But if I don't chew properly, could I be affected by how fast I consume the food?
Well, if you chew too quickly and you swallow too quickly, then the satiety or satisfaction center of the brain doesn't recognize that you are eating, and it doesn't tell you that you are full fast enough. So you continue consuming more and more food, which is not necessarily ideal. You eat what is sufficient and then you stop.
So people who eat or masticate too quickly are at risk of eating too much.
There are potential risks.
Better to eat properly, because some of you might be overweight because of your teeth. Be watchful as to how much you masticate and how well you masticate your food. We are talking about dental health, and we are here with Doctors Sweet and Ovid. We will be right back as we continue our discussion on how we consume our food.
I'll forever trust in you, Jesus all the way.
JC24/7.
The Lord provided for a time for the slaves to be set free, for the debts to all be canceled, so his chosen ones could see. His deep desire was for forgiveness. He longed to see their liberty, and his yearning was embodied in the year of Jubilee. Sing! Jubilee, Jubilee, Jubilee. Jesus is the Jubilee. Jubilee, yeah. Debts forgiven, slaves set free. Jesus is our Jubilee. At the Lord's appointed time, his deep desire became a man, the heart of all true jubilation, and with joy we understand. In his voice we hear a trumpet sound that tells us we are free. He is the incarnation of the year of Jubilee. Go! Jubilee, Jubilee, Jubilee. Jesus is the Jubilee. Debts forgiven, slaves set free. Jesus is our Jubilee. Jubilee. Jesus is the Jubilee. Debts forgiven, slaves set free. Jesus is our Jubilee.
JC24/7.
Better to eat with. We are here with Doctors Vaughan Sweet and Delphina Ovid as we continue our discussion on dental health. Dr. Sweet, you talked about the soft toothbrush as against the hard toothbrush. How often should we change our toothbrushes?
The real problem with needing to change the toothbrushes is the wearing down of the bristles. So that when you brush, over time the bristles tend to get worn, and they're not as effective in removing the food particles from the teeth. So that usually happens within 1 to 3 months.
Right.
What can accelerate the wear down of the bristles will be if you bite the toothbrush. And that will cause the bristles to get worn very quickly.
Right.
Or if you brush too hard.
Okay, okay. Sorry, go ahead.
But brushing is not the only important method of keeping the teeth clean.
Okay.
Flossing is important as well.
Okay.
And we normally recommend that you floss once a day.
Once a day?
Yeah.
Once a day. It's only once that it needs to be done.
Wow. Okay,
Normally we say at night before you go to bed, you floss and you brush.
And you can use any kind of string or
Well, we recommend dental floss.
Dental floss.
And you have to remember your toothbrush can't get between your teeth. So that's the purpose of flossing.
Oh, okay,
right?
okay.
And flossing is not just up and down like this.
Okay.
What you have to do is you pass the floss between your teeth and you make a C.
And hold on to the teeth.
Right, and you actually floss the tooth.
Okay.
All right?
All of the teeth, eh?
Yeah.
My goodness.
All the way down to the back.
Oh, man, that could take forever. But it's necessary, I suppose.
Yes, definitely.
Okay. The gum. Should we also include the gum in terms of our teeth, care of the teeth? Should we brush the gum?
Yeah. What we
And the tongue
recommend
as well.
is you brush along the gum line because that's where the plaque and food debris and calculus accumulates. So you brush along your gum line. You're not going to exert extreme force to damage, to brush away your gums, but a brush along your gum line.
Okay.
Yes.
And is toothpaste the only mechanism we can use to brush our teeth? If for some reason I run out of toothpaste and the drugstore is closed, the grocery is closed, am I doomed?
One of the main ingredients in toothpaste is the abrasive that is used to remove like the stains on your teeth and the food debris and so other abrasives like probably salt or baking soda.
Okay, that could work just as good.
Yeah. But remember, don't use too much force because we don't want you to end up with sensitivity.
Okay.
Right?
So you must brush. You have to have a certain force on the teeth, but it must not be too excessive.
Right.
Okay. Tongue. Do I brush my tongue as well?
Oh, definitely.
Okay.
You're not complete if you only brush your teeth. You also have to brush your tongue because there's bacteria in your mouth, and also there can be food debris that settles on your tongue.
Okay.
So brushing would help to remove that.
Okay. What are dental sealants? And who should use it? Who's advised to use it?
Sealants are a plastic material that is applied to the biting surfaces of especially of the back teeth, to block up the grooves. We spoke about the grooves being the place where the decay will start if sticky foods are eaten regularly. So patients who have a risk of developing cavities in those sticky grooves, what we do, we apply a thin layer of that plastic material that blocks up the grooves and prevents food from sticking in it, and that in itself will prevent decay from occurring.
Sure.
Just with the, in order for caries to occur, 4 factors must be present, right? You have your teeth, bacteria that's always present in your mouth, food, and time.
Okay.
So if we could get rid of one of those factors, so if you put the sealants on the teeth, of course the food can't settle there. So that helps to prevent the cavities.
Let's get back to this whole matter of toothpaste. And without calling names, how do I go about deciding which toothpaste to use? Because a lot of them call for my attention. But how do I know which one to use and when?
Most toothpaste contain the exact same ingredients. So if you go to the grocery or the drugstore and you pick up the boxes of toothpaste and you look behind them, most of them contain the same ingredients.
Right.
The only difference would be toothpaste, or the main differences will be toothpaste for sensitive teeth.
Right.
And toothpaste that are that help prevent gum disease. So to help prevent gum disease, we'd use something like toothpaste that contains triclosan or some other antibacterial agent. And toothpaste to help prevent sensitivity would be something that contains a potassium nitrate. So that is the main thing. So there are two different formulations of toothpaste that are for sensitivity and for gum health care. But apart from that, all toothpaste contain the abrasive, the humectant to keep it a kind of a watery paste and so on. They all contain more or less the exact same ingredients. The fluoride to help strengthen the surface of the tooth. So
almost every child that I know personally, has either developed a propensity to suck finger or to suck the tongue and stuff. Is something wrong with that? And how detrimental can it be for dental health itself?
Well, the problem with sucking your finger is that it exerts a vertical force. It exerts a vertical force on the teeth, as well as a horizontal force. So we normally find patients who have what is called, what we call in Trinidad parlance, buck teeth. In other words, the front teeth have been pulled forward because of constant sucking. So there's a horizontal protrusion. What can also happen is an anterior open bite where the back teeth are touching, but the front teeth are open from each other, and there's a space that has developed over a long period of sucking.
That will put pressure on, well, it might challenge your ability to chew well.
Yes, it does. And it also affects the smile. So the problem with the thumb sucking is that it exerts orthodontic forces. You know, orthodontics with the brace, it exerts braces forces on the teeth over a long period of time that affects the development of the jaws as well as the development of the final position of the teeth.
That also is affected by sucking your tongue as well.
Yes.
Protrusion.
Protrusion
those
as well.
Forces,
As a substitute for that, parents give their babies pacifiers. Is that safe?
The pacifiers create some of the same effects as well.
So that's not a safe thing. Are there some diseases, dental diseases, that are maybe genetically transmitted from one person to another?
What I like to say first, though, is that some people think, from generation to generation, some families, they practice similar poor oral hygiene habits, all right? And then, so they might say, oh, their father lost all his teeth at age 40, and they expect a similar situation. But most times, that can be corrected if they practice proper oral hygiene.
I hear you. I hear you. So it may not be transmitted. The habits might be transmitted, but not necessarily the disease.
There's an increased risk. Some diseases, for example, periodontal disease. Some patients might have an increased risk for developing periodontal disease because of their genetics. Approximately 15% of the population has this increased risk of developing advanced gum disease even in the presence of minimal plaque. Whereas the average population will require a lot of plaque over a long time to develop a lot of bone loss and infection of the gums. Some patients are extremely susceptible to a small amount of plaque, and that propensity is transmitted genetically. However, just as Dr. Ovid said, if those patients were to visit the dentist regularly, were to practice better oral hygiene practices, even that propensity to increase risk for gum disease can be held at bay or even treated.
I suspect that diseases that affect the teeth will be no respecter of persons, regardless of age and stuff like that.
Correct.
I suppose if we don't maintain good oral hygiene, we will be susceptible to any kind of disease.
Correct.
Doc, as we seek to wrap up our discussion, I have been told that each person has a specific dental pattern. How true is that?
That is true. When we look at the individual teeth, we can recognize that The lower molars have a particular general shape. The upper molars, again, have a slightly different shape. The incisors have a different shape. But that's a general shape. Within each particular individual's mouth, there's a unique shape that deviates maybe slightly from the general pattern.
Right.
And the arrangement of the teeth in the mouth, there's a general arrangement in each arch, but the particular arrangement in each arch is, in each person's upper and lower arches, is unique.
Okay.
What that combines to create is that each person has a particular specific bite.
Wow.
So that if you were to bite someone, and, then you would leave a particular arrangement of marks on the individual's skin.
Right, right.
And in court, that is used.
Yeah.
Molds are taken of each of the suspect's teeth.
Right, right.
And you can compare the bite marks that will be created from those teeth and the bite marks that are on any individual. So that is useful in court. Forensic odontology.
Okay, all right.
What is also useful in, what is also done in forensic odontology is, for example, if you have a burn victim, that the face is completely destroyed, you can't recognize the individual. If you have adequate dental records, both dental models as well as radiographs, and a good record of what treatment was done, you can identify burn victims very well.
Right.
And that was used as well in some recent cases that Trinidadians know about.
So you must have records.
You must have records. You must visit the dentist.
All the reason I hear you on that. In your opinion, does it speak highly of a creator God?
Yes, it does.
Okay. Okay.
I agree. There has to be a designer.
There must be a designer.
Yeah,
okay.
definitely.
I mean, it's difficult to see something as evolution, which has its proposed genesis in something that is so random, be responsible for creating something so complex as a design of the teeth.
Yeah. Yeah, it is definitely, it speaks volumes for our creator.
Praise the Lord.
And we haven't even touched on the extent of the elaborate nature of the design of the teeth. But if you want, once we go further into that, we would find
that instead of my visiting your office, you can visit JC24. What do you say about that? Well, I want to thank you both for taking the time to be with us, to educate us a little bit more about dental care. Jesus would have us believe that it's important. Remember, after the antediluvian flood, when God had instructed the people of God to divide the food that they must eat into clean and unclean, I took note of one of the animals that was labeled clean. It was the goat, which chews its cud. It swallows, it chews before it finally consumes the food. Maybe there's a lesson in that for us. Before we take anything into our physical body, we must chew properly. But spiritually is also true. Before we consume any kind of doctrine, any kind of theories, even as evolution, we must chew to ensure that it is good for our health. I recommend the Word of God to you. Masticate it well, and it will do good to your bodies and to those with whomever you come in contact. Thank you for coming in contact with JC24/7. We look forward to having you once again. And thank you, Doc, for joining with us.
Thank you so very much.
See you next time on JC24/7.